Hi.
Hi. Okay. I will state my 12 safety practices. One, will check the orders, do hand hygiene, verify the facility, policies and procedures, check the manufacturer's procedures for any equipment that's needed, perform hand hygiene, note the patient's overall condition, knock on the door, don PPE, explain the procedure, raise the bed to a proper working height, and then lower the bed. When finished, give them their call light, dispose of anything that I used, and then I will note any abnormalities to the charge nurse. Okay, so first I will be initiating a peripheral line. We'll come in, knock on the door. Hi, I'm Tiffany, and I'll be putting in an IV line on your arm, okay? Then I will provide privacy. We'll put on the gloves. Okay, so open the kit, get my tourniquet out. I will inspect the patient's arm to see where I would like to insert the IV. I see an area that I would like to use. Release the tourniquet, take the initial set of gloves off, wash my hands, and then I will come back and I will pop this open and I will clean the patient's hand. And toss that. Get my Tegaderm out. I would write my name, the date, and the gauge of the IV. And I'm gonna get my tape ready. Okay, and then since that is dried, I will untie my tourniquet, and I will go ahead and connect my saline solution.
Nice catch.
So we'll remove the lid from the piggyback and I will flush a little bit of solution to ensure that the line is open. I will lock it. I'll put it back in the packaging to ensure that it remains sterile. Recap it. Okay, now open my needle. We'll inspect the needle, make sure that it's good, make sure I insert bevel side up. Go in, I'll feel a little pop. Then I will get a flash. And then hold that there. I want to gauge the safety. And then we'll remove that. And we'll connect. Oops. And making sure, the whole time, make sure I'm holding the IV in place. I will release it. So that way I can flush a little bit of saline in there to ensure patency of the line. And that's there. I can tape the IV in place. Release that. Bring this around. Place that there. Apply the Tegaderm, and then I will look and make sure everything is okay, making sure that there's no redness or anything on the IV site. And then once that's finished, I will load a patient bed, give them their colite, and clean up all of my equipment. And then process and that procedure is done. Next, I will administer medication or an IV push AOV morphine. So come in, knock on the door. Hi, I'm Tiffany, and I'll be giving you an order of morphine. Make sure I provide for privacy. Get everything that I need. Make sure that's the right medication. I'll get my needle that's needed. I'll have alcohol swabs. Okay, so we'll come in and verify the order. It's 2 milligrams. So what I will do first, I will open alcohol swab. I will scrub the hub for 30 seconds. Toss that. Make sure my needle is connected. And I will have to draw up to the ear. Oh, I digress. First, before I do that, I will ensure that I clean the medication hub. I will scrub the hub for 30 seconds. Then I will remove the safety cap off of my needle. And once that's dry, I will insert the needle in, insert the air, and then I will draw up my medication. Excess air, and then I will replace the cap. Before I will put any type of medication, I will look at the site to make sure that there's no redness, no swelling. Make sure that it's not warm. Same with 6 rights. I have to make sure that it's the right patient, right drug, right dose, right date, right route, and right documentation. Okay, so since all of that, everything is good, remove the needle. And being that it's morphine, I will slowly push over the course of 5 minutes. Prescribe the 2 milligrams. So like push, stop, and then wait, I digress. Before I actually put the medication, I will have to flush the line for patency to ensure that it's not clogged or anything like that. And then I will connect the morphine, push over the course of the 5 minutes, and then I will disconnect that. And then I will get a saline lock, and then I will connect that. And then I will push the amount of saline in with the equal to the amount of morphine that I pushed in. I'll do the same thing I did with medication. Push slowly over the course of 5 minutes. Push, stop. And all the time that every time I stop, I'm looking to making sure that the line is still patent and make sure that the medication is actually being administered correctly. And once that's finished, I will disconnect it. And then I will ask the patient if they're feeling any type of burning or itching sensation or tingling or anything. And as long as they aren't feeling anything, then the procedure will be complete. I will go and I will document it. I will let the patient know that they could possibly feel dizzy, that possibly feel like there's like a tightness, like with a weight with the breathing, and it could lower their blood pressure. And then to make sure that they call before they get up, because that makes them a fall risk. I will give them the call light, and that's when, once that's finished, then I will go and do the documentation. And that ends that. I will dispose of all of my stuff. Next, I have to begin a nasal normal saline IV. It's for 150 milliliters an hour over 8 hours. You break that down with my bag that I have. It would be 50 milliliters. So I will get the bag and I will knock on the door, introduce myself. I'm Tiffany. I'll be giving you a saline medication. So that's me explaining the procedure. Make sure I have everything. Now I will open this, make sure that I spike the bag. Ensuring that the line doesn't touch the ground. So I have to flush the line. So this isn't working correctly, it's not flushing out, but I would make sure that the drop is there. I would look for 30 seconds to ensure that it's the proper rate. If it's not 30 seconds, and then if it's not there, then I will go over the course of a minute to ensure that the fluid is actually dropping at the rate, which, like I said, would be 50 milliliters a minute and 50 drops a minute. And so once that's there, once that's completed, then I would clamp the line back off, ensuring that this does not touch the ground still. We will get an alcohol swab. I will scrub the hub. Also, I'll look at the site and make sure that it's not red or swollen or warm to touch, making sure that everything's good visually. back a little bit, make sure it's a flash, and then I will flush for patency. And so that's good. Disconnect that. And then I will connect my MD. And then we'll go back, open the line to start the IV if it was actually going. And making sure, looking along the line to make sure everything is going the way it's supposed to. And then I will, as long as everything's good there, I'll note how it's looking after the new line has started. And as long as everything's good here, then I will lower the patient, give them their call light, and then I will document the procedure, and I will annotate any type of abnormalities that are done, and that is complete.